After working with so many people at the end of their lives, has it changed your view of life?
It has. It really has. I'm a lot less afraid of dying. I think that seeing how people have reacted to the moment that they pass and how their families are at peace, I feel much better about it. I really do. And knowing that there's a place like this in San Miguel, it actually, a lot of people say it jokingly, oh, reserve me a room for when it's my turn. But it's actually a good place. It's a very peaceful environment. It's a happy environment. As you can see, we have lots of color and a lot of happiness. We have a beautiful garden. You can bring your pet. You can have your family photographs. It's really led me to believe that it's okay. My name is Nancy Stich, and I'm the president of the board of directors of Mitigaré Palliative Care Clinic here in San Miguel de Allende.
Thanks for joining us today, Nancy. Can I ask you, what was the spark that led to the creation of Mitigaré, and how has it evolved over time?
It actually started in 2007 as San Miguel Hospice, and it continued from 2007 to about 2014 under a totally different concept. And then in 2016, it was founded as Mitigaré Palliative Care, with the idea that not only the expat community needed this kind of services, but the whole community of San Miguel really needed this. And we're actually the first non-for-profit hospice care in the entire country.
And what are the biggest challenges facing Mitigaré right now?
I think our biggest challenge is that people don't know we're here. I think part of it might be with an Anglo name on our wall. People think that it's only for the expat community, which of course it's not. In fact, over 90% of our patients, almost 98% of our patients are Mexican of the San Miguel community and in the areas around San Miguel, in the countryside. But I think that has been our major efforts have gone into letting people know that we're here for all the community. Last year, less than a year ago, we did a health fair where we tended to over 100 neighbors, and we did over 1,100 tests, everything from glucose, blood pressure, homeopathic, massages, holistic, and just so the neighbors could know that we're here and we are part of this community.
Could you share with us a success story that really reflects the impact of your work?
The most important part of hospice is how the patient and the family react when they know they're not alone. They know that someone is going to take care of their pain, someone is going to help them through the process, either that be legally or religiously or emotionally or whatever they might need. But I feel that we have the whole complete umbrella of taking care of the person and their family. And I think this has been very noticeable in a lot of cases that we've had. We have had children from 2 years old, the people in their 90s, and grief is universal. And it's just the same for a child as it is for someone that's in their 90s. And I think that learning that grief is so universal and that people really need to be comforted, I think that is the most important thing we've learned. And I think one of my most memorable experiences was a little girl that we had. She was only 4 years old, and she had a terrible brain cancer. And we would go and see her every day, the whole group, the nurses, the doctors, because it was at the very end. And she said at one point that she wanted a gansito, which in Mexico is a little cupcake that it's full of jelly and it's covered with chocolate. And within 20 minutes, she must have had 20 gansitos. Everybody just went out and just ran out to make sure that she was covered by what she needed. And of course, the next day she wanted pizza. But so it was but the whole idea of helping the patient with what they want, it might be talking to the chaplain and saying, I have an hour left to go, a couple hours, a couple days. I'd like to talk to someone religious. And if you're in this position that you're on the end, you don't know how to make that connection. So we have someone that can say, okay, you're Jewish, Catholic, Protestant, whatever, I can bring someone in to talk to you.
And if someone is watching this, as well as giving a donation, what's the most significant thing they can do to help?
As I mentioned to you before, we do subsist entirely on donations. Even our employees are paid through donations. But we need a lot of volunteers. We need volunteers that can help in reception. We need volunteers that will go out to different community events and let people know that we exist. We just need people to be part of our community. There are needs for people to be part of our chaplaincy services or be part of our grief sessions. But not everybody is able to do that. We're well aware. So I think just being part of our community is what we really need. We have our website and it has all the numbers, and you can definitely call, or we're here Monday through Friday from 8 in the morning till 5 in the afternoon, and someone's always here.
What's the biggest misconception people have about hospice care?
I think they probably think it's much more clinical than it is. They probably think it's somewhere where you go and a doctor gives you medication to control your pain symptoms. I don't think most people realize how much it encompasses the emotional part of dying. And we really try to cover that, all those aspects with our chaplaincy, with our counselors, with our thanatologists, with our social workers, even our nurses. Our nurses are specialized in palliative care. They know how to deal with this.
Can people actually get better whilst they're in hospice care?
Yes, they can. In fact, they call it graduating from hospice care. And since palliative care actually can be anywhere up to 5 years before a patient dies, it can be anywhere once they have received a terminal diagnosis. So a lot of times patients do recover. Patients go into regression with their cancers, or they're in remission. So you can actually graduate from hospice. It's a good thing.
What does a good death actually look like?
There's all kinds of deaths. I worked for over 30 years in a hospital and I saw all kinds of deaths, but I think the best death is a peaceful one, where the patient and their family feel respected, and they are treated as a very respected human being. It's a moment in life, much like birth, that should be joyous. It should be someone going on to the next stage. It should be without pain. It should be with total respect with all the people around you. And I think being in hospice, one of the things we're very good at it with our social workers is also bringing together the family. A lot of times when a patient is dying, you're going to have conflictive family members. We should do this, we should do that, we should do this. And with our social workers and our grief counselors, a lot of times it brings the family together, which is the best thing for the patient, because he's not surrounded by someone, conflict over here, and my mother says this, and my father says this, and what should we do? And he's surrounded by peace, and that is the best way to go.
What are people most afraid of at the end of their lives?
Good question. I think people are most afraid of the unknown. I think we have been taught our entire lives that if we're religious to some sort, there is something beyond. And if we're not religious, it's like there is nothing beyond. So I think it's just the fear of the unknown. And I think that being around people that have dealt with so much death, as our doctors and nurses and grief counselors, I think they realize that it is a very peaceful thing. And it should be a joyous moment. The person will be without pain. They'll be going on to a new stage of life, and their family should be very at peace and knowing that they're in the best situation.
And does dying usually hurt?
In hospice, our number one concern is pain control. It should be, so that the patient is without pain, because without pain you can make good decisions, and you can also enjoy those final moments with your family members.